Time now for a look at your health. March is colon cancer month. It is the third most commonly diagnosed cancer and the second leading cause of cancer death in both men and women because it is so insidious. So what can you do about it? Well, UCSD's Dr. Mitchel Goldman is here once again, as he is every Tuesday, to tell us about the importance of early detection. Thanks for being here.
Great to be here.
Let's talk about the numbers first of all. How many people are stricken with this?
Well, about 50,000 people die from colon cancer every year, and hundreds of thousands are diagnosed. But just like many forms of cancer, like skin cancer, early diagnosis means an effective treatment which can cure you of the problem.
But isn't one of the issues with colon cancer in detecting it is the fact that the symptoms really aren't all that definitive?
You're absolutely right. The symptoms are usually just a little bit of bleeding, but people attribute that to something else, like a hemorrhoid. And one of the biggest problems we have, especially in the older population, is they don't particularly want doctors looking down there, and they don't want doctors doing tests. And so that's where we get the problems. A simple test done every 10 years, a colonoscopy, can find the pre-cancerous lesions like polyps and cure the problem.
And what age should you start doing that? Is there any debate on that?
Well, the American Cancer Society recommends that people at the age of 50 should get their first colonoscopy, and then if they don't have a family history, ulcerative colitis, or other reasons, they should get one every 10 years.
And you brought up some of the risk factors, and those are on our screen. My father had colon cancer, and so it's something that in our family that we're doing at a younger age. And really, talk about the colonoscopy for a second, because it's cringeworthy, but the truth is it's not that big of a deal.
It isn't. And when you look at this picture of the colon, you can see that when the cancers are found early, they're very easily treatable. But once they get to a big stage, they spread throughout the body. Now, colonoscopies these days are done with very small instruments, and usually you're given a light sedation. So when I had mine done, because I'm now 58, when I was 50, I woke up in the recovery room saying, is it over yet? You know, was it good for you? And it was not a difficult procedure. The worst part about the procedure is preparing for it before, because what you need to do is clean out your colon. As you can see in this video, where they're actually looking at the inside of the colon. So there's actually a little camera that you can take. You actually swallow it and it looks through the colon. But the key thing, whether you have a colonoscopy or you take a little camera pill that looks through everything, is to make sure your colon is really clean. And so follow your doctor's advice on how to properly prepare yourself.
All right, well, thanks for bringing it to our attention. March is the time to do it. Dr. Mitchel Goldman, thank you so much.
Always good to be here.
All right, early detection, Walter, early detection.
Some good advice.